Hi everyone. So welcome to another episode. I'm here with my close friend. Smilos is what I call her. Her name is actually Smile. Well, I call her Smilos because she's as sweet as sugar. Sugar Smilos. So Smile, introduce yourself, please.
Hi everyone, my name is Smile, like she said, and I'm a nurse by profession. Yeah.
So welcome, Smile. You are officially the first nurse on this show.
Wow.
Yes, guys, she's a nurse, and we're going to tap in from her knowledge today. When I called Smile, when first thing I asked her was, "What is one of your fears that you normally have?" And she was like, "It was normally anxiety." And I said, "Wow, me too. I have that too." And I invited her to here today so that she could just tell me her own experience. Then maybe I could compare with mine, and then we'll just get right back and see how to solve this issue. So, Smile, when do you get anxious? Like, what kind of situation, just stirs up anxiety for you?
Well, basically, as a youth or as a girl in her 20s, that fact alone stirs up anxiety because most times I'm like, oh my God, what am I doing with my life? Like, what's next? Where am I going from here? And sometimes it's like you're just stuck, like you're not even making any move in life at all. And then most times when you just go through social media and you see people you know, your colleagues, your classmates, they are doing things, making achievements, and you're like, what am I doing with my life? So most times thinking about those things alone will just make you anxious.
Well, I think it happens to everybody because at some point it'll be like, where are you at this point in your life? Are you supposed to be where you're supposed to be? What's going on? What's working? How do you stop this? How do you go forward? But there's no problem about it. I think most people generally, like me, is normally when I'm scared, I get anxious. If I'm scared like this, I get anxious. If I'm stressed, I get anxious about anything. Normally, when you find yourself in that situation, when you're anxious, what do you normally do?
Okay, the first thing I do is to just calm down, like relax first of all, and then take a deep breath seriously. Because most times I notice, for example, I wake up in the morning and then I look at the time and I'm like, oh my God, I'm almost running late. And you know that feeling, you would want to rush things. And the more you rush things, the more you make mistakes. So at some point, I'll just wait, like I'll just stop everything I'm doing and then relax myself first. And then I'm like, okay, fine, what next am I supposed to be doing from here and there? And then, you know that with that now, I've organized my movement. So the first thing I do is to stop thinking, stop whatever I'm doing, and just calm down and take a deep breath first and settle down, like organize my thoughts and everything. Then I can proceed.
It's very nice. Yeah. I remember when I was going for one interview like that, I was so anxious like this. Like my palms, like literally see my hands dripping sweat like this. I was so anxious. And then my tummy was just running. It was a very bad experience. And most of these things tend to progress. If you're someone that suffers anxiety, or just find out what works for you in bringing it, like just slowing it down a bit, because some of those things are hormones. You're just trying to mess up your mind.
And most times too, as ladies, our hormones play with us a lot, because I know that there are times when I know during ovulation or even before my menses, there's this thing they call premenstrual syndrome. It happens to me a lot. And then I notice I just become irritable, like little things irritate me. I suddenly start having depressions and little things scares me. And then I'll just start thinking like, oh my God, what am I going to do? I know these thoughts of like, what am I doing? And all those thoughts, they just keep coming. And at some point, most times when it happens, the first thing I do actually is to look at myself and I'll be like, wait, what time of the month is it? Because because I know I suffer a lot from this PMS. So at some point I'll be like, okay, fine, maybe it's because it's actually the PMS working. And then I'll calm down. But other times when these thoughts come, I'll first of all tell myself that yes, it's normal actually to feel anxious, because anxiety it's something that happens to us every day, and then it shouldn't really affect our lives. It shouldn't affect everything. So the problem is the problem now becomes when these things keep reoccurring, and it's like it's beginning to affect your daily activities. That's where it actually calls for you seeking medical attention. But anxiety, I would say, it's something that keeps us moving, because in a way it pushes us to. So when you realize these things, sometimes it's a point for you to just sit down and have a rethink and have some sort of self-reflection. And so it's totally normal to be anxious, but the thing is, know what triggers it.
Yes.
Everyone is
very
unique.
Important.
Know
very,
what triggers it, and then if you actually know what the problem is or the trigger, you've gone like 50% in solving the problem. Yeah. If probably you've been anxious and then you look at your day and you're like, okay, I had a stressful day. Definitely stress plays a role when it comes to do with anxiety. So the first thing you should do at that point is try to manage the stress. Try to maybe rest, get some sleep or something like that. It will definitely help.
Okay. All right. So we are going to just take it again, like some of your symptoms now.
Yeah.
When you're anxious, you know that, okay, this is just anxiety. For some people, anxiety is like, it progresses to a panic attack.
Yeah.
Like you just see them, they just,
yeah.
Some of them, they at the point, they'll tell you they can't even breathe.
Like so, something is choking
like
them.
Something is choking them. Like some people now, do you think anxiety could be genetic in what form?
Yes, I think so.
It could be genetic.
It could be genetic.
What signs do you see before you can actually say, okay, this is just me feeling anxious about something? What are your symptoms? Like me, I normally have sweaty palms when I'm anxious. And apart from sweaty palms, my tummy starts turning. It feels as if I have a stomach disorder. Yeah. So those are my own symptoms. So what are yours?
Okay, my symptoms are, like, first of all, my tummy. I feel like I'm stooly. Like, I feel like I just have this sudden diarrhea and all that. And then secondly, I feel like my heart, my blood,
your blood pressure increases.
My heart rate increases, and I can feel it in my chest.
Okay.
And so that's why I said the first thing I do is to calm down. When I feel that way, I'll be like, okay, fine, just calm down and all that. So another thing I feel most times is I'll feel myself trembling, like I'll start shaking. I'll start shaking, my body just starts shaking all of a sudden, and I'll know that, okay, this is it.
At some point, there was one time it was really bad. I think I started having a fever.
Yeah.
After that, like I started having a fever.
Physical symptoms.
Man, so after noticing these triggers now and after seeing them and saying, okay, this is what causes anxiety, or this is what causes why I'm feeling what I'm feeling, or this is the reason why I'm feeling what I'm feeling actually. Yeah. So you talk of some symptoms now, apart from those diagnosed ones in which some people have to go as far as seeing a psychiatrist or a therapist, but those are the advanced forms of anxiety. What would you say are some solutions for people that are feeling anxious, apart from telling themselves calm down? You know, some people using their mouths to tell themselves calm down, it's not as easy as you may say. You may be telling yourself calm down, but at the end of the day, your nerves are acting the way they are, so it's not as easy as telling your nerves, oh, calm down. So what can you do exactly to relieve yourself of anxiety?
Okay, first of all, I would say music therapy works for me. Like
I can't overemphasize that enough.
If you go through my phone, lots of playlists, and then my playlists are arranged according to my mood. There's one I have. I have a playlist for dance. I have a playlist I call Cool. So there are moments when I'm overly excited. I just need something to like make me calm down. I'll just go to my playlist, the one I have for Cool, and then I start playing cool music. And at a point, it will just make me calm down. Like it will make me so calm and sober. And then there are moments where I'm feeling down too, or I know I'm feeling anxious. I have some for motivation. I just go to my playlist for motivation and play it, and then I'm like, okay, so music therapy is one thing that works for me. And then another thing I do is I talk to someone, because yes, I know no one is an island. We need people around us.
Yes,
so even if the person at that point would not give me 100% solution, but talking to someone would help. It distracts me. Yeah, I remember times where I'm just talking to somebody about something else, and then I'm getting an idea for something else that wasn't even related. So if you talk to someone, it could help. Yeah, even if you don't really tell the person that, okay, I'm feeling so stressed, and you can just talk to the person and you guys will discuss random topics and all that. And like you said, it would distract you from that. And then another thing too is to just, one thing I do as well is read. I love reading a lot. So most times, if I'm just there,
I think you and I we are opposites.
I pick up a book.
I'd rather see a movie.
Nah, no, I'm not a movie freak.
I'm a movie fan. I'd rather see a movie than just to pick up a book, because picking up a book, my thoughts will just distract me. In as much as I'm trying to imagine what I'm reading in the book, my thoughts will just distract me. So, music, talking to people, reading a book, add watching a movie.
Yeah.
So,
and
thank you, Smile.
Meditation too.
Meditation, yes, very, very important. God first, a human being second. So thank you guys for watching this video. Would you like to do the honors? Tell them to subscribe to my channel, please.
Okay, if you haven't subscribed yet, just pause right now. Pause the video and then click on the subscribe button now. Now.
All right, thank you so much. Bye.
Bye.